Pyloric stenosis. Pyloric stenosis is the thickening or swelling of the pylorus that causes the narrowing of the opening from the stomach to the intestine, which blocks stomach contents from moving into the intestine. Pyloric stenosis is a problem that affects babies between birth and 6 months of age and causes forceful projectile vomiting that may project to several feet and can lead to dehydration. This is the normal anatomy of the pylorus versus the pyloric stenosis. Congenital hypertrophy, aka gastric outlet obstruction. Stomach cannot empty its content and get distended. Babies at high risk. Caucasian babies, which tend to develop pyloric stenosis more frequently than babies of other races. Males, who are 4 times more likely to develop pyloric stenosis than girls. Genetics. Pyloric stenosis may be inherited by the parents. Signs and symptoms: weight loss, lack of energy, ravenously hungry despite vomiting, fewer bowel movements, constipation, frequent mucus stools. Projectile vomiting after feeding, constantly hungry, voracious appetite. Diagnosis for pyloric stenosis. Blood studies. These tests evaluate dehydration and mineral imbalances. Abdominal X-ray, a diagnostic test that uses invisible electromagnetic energy beams to produce images of internal abdominal ultrasound, a diagnostic imaging technique that uses high-frequency sound waves and a computer to create images of blood vessels, tissues, and organs. Barium swallow or upper GI series, a diagnostic test that examines the organs of the upper part of the digestive system, such as esophagus, stomach, and duodenum. Treatment will be determined by your baby's doctors based on baby's gestational age, overall health, and medical history, the extent of the problem, baby's tolerance for specific medications, procedures, or therapies, parents' opinion and preference. Recovery time. Babies can often begin drinking small amounts of clear liquids in the first hour. Babies may still vomit for several days after surgery due to swelling of the surgical site of the pyloric muscle.